Good morning. Um, get started. This is a very personal topic for all of us working in healthcare. 100 million. That's the number of Americans who today don't have access to primary care or adequate primary care. What does that mean? That means that they cannot make an appointment when they need it. They have medical conditions that they are not able to treat. And that number is staggering. It's one third of us. And probably people here in the audience have experienced how long it takes to make an appointment to find a doctor. You move to a new city, find a primary care physician, and this is this audience, right? Sophisticated audience in researching and being online, etc. Think what's happening in the rest of the country. The problem is caused by a shortage in primary care physicians. So we have a mega shortage of primary care physicians today, and the problem is getting worse. It's not getting better. By over the next decade, we're going to have 87,000 too few primary care physicians in the country. That means that if you want care, you are not going to get it. That means that more hospital admissions, more ER admissions, more chronic conditions that will go unmanaged because of the lack of primary care. The problem is not just clinical, the problem is also financial. So primary care controls $3 trillion of spend in the country. An avoidable hospital admission because a patient is healthy, an avoidable ER admission, a picked up medication on time that makes a chronic condition not get exacerbated. That's all positively impacted by primary care. Yet we have a primary care desert in the country. This is what we're doing. This is what Lumeris is doing. This is what we're trying to do. Um, and so what we've done over the past few years is taken 15 years of primary care knowledge, combine that transformation knowledge, combine that with 10 years of investment in technology infrastructure, and added to that 3 years of Gen AI investments. Over the past 3 years, we've all made these investments. We've combined it all, and we created a utility-like service. We call it primary care as a service. The product name is Tom. And what Tom is a primary care team member that we deploy with health systems. And Tom becomes a team member of of a team that's comprised of a primary care physician, NPs, APPs, and Tom. Tom is delegated tasks by the primary care team, and Tom now has infinite scalability to address the needs of a patient panel, allowing actually physicians to, unheard of, expand their patient panels. We foresee physicians being able to expand their patient panels to the tune of 100%. Some health systems have actually bigger aspirations. The way it works, I'm going to talk about how is it built and how does it work very quickly. So how it's built, a platform that ingests all sorts of data, EHR data, claims data, consumer data, activities on Twitter, partnership with my friend here, Tom, and Ura. And so we ingest a whole bunch of data, we slice it, dice it, normalize it, then we run it into a multi-agent best next action engine that determines in real time, at the end of one patient, what do I do about that patient to get that patient to a better health state? And then that framework then deploys agentic services. In primary care, there are about 300 agentic services that are deployed. We deploy these services, and those services engage with patients conversationally, multimodal fashion, multilingual, taking into account their social determinants of health, from as simple as engaging with a patient to remind them that they need to get a colonoscopy and scheduling them, all the way to more complex chronic condition management in between visits, so that blood pressure remains under control, blood sugar remains under control, and if it's not, escalations and triage and whatnot. So we're super excited. We're deploying this system across the country in partnership with health systems, keeping the primary care physician at the heart of the equation. And our belief is with this concept of primary care as a service and primary care being a utility and a right for every American to have, we're going to address the major challenges in healthcare in the country.